I am Dr. B.G. Ramesh, Professor and Chief Consultant Neurosurgeon, and is Dr. Karthikeyan. He is my colleague in the Neurosurgery department. He is also a consultant. We want to present a rare case of a neck tumor which is pressing on the spinal cord. It was a large tumor. It was a challenge to the neurosurgery because it had to be operated in 2 stages. One, we had to operate from behind, then remove the pressure on the spinal cord. Then we had to remove at the second stage from the neck. Technically also it was very difficult because it was encircling very important structures going to the brain. And very important thing was, what is the unique thing about this case was, it's one of the rare pathologies. The tumor, normally we expect a benign tumor there, but it was a malignant tumor which normally occurs within the brain and the spinal cord. But this has occurred in the neck. It's called ependymoma. Ependymoma occurs within the brain and spinal cord. It has occurred outside the neck, and also it was extending into the spinal canal to press on the spinal cord. So this sort of tumor has not been reported in this location in the world. This is the first time it has been reported in the world. We are also checked the world literature on this, and this is the first time such a tumor has been encountered in the neck outside the spinal canal and brain.
What was the duration of the operation, sir?
The operation was done in 2 stages. First stage we did from behind to remove the pressure on the spinal cord. That took about 2 hours. Second stage took about 3 to 4 hours to remove the pressure. That was more challenging actually, to remove the portion of the tumor from the neck, because it was lot of blood vessels going around, and there was lot of bleeding and everything we had to control and then do. So it was a difficult operation, as well as one of the rare tumors pathology wise, and this operation would have costed him around 3 to 4 lakhs minimum if it had been done, if he had been paying for that. Thanks to our Chief Minister's comprehensive scheme, this was done free of cost to the patient over the stages, and now he is undergoing radiotherapy in another hospital. That also is under Chief Minister's scheme.
This is a post-treatment?
Post-treatment radiotherapy.
How long he is supposed to undergo?
It takes about a month. Yeah.
So that costs again separately,
or it's
included?
It is included in the scheme, insurance scheme.
Okay, so how, I mean, at what intervals he is supposed to come for the radiation treatment?
No, he is having it 5 days in a week, and about 4 to 5 weeks they will give. That's it.
So is there a possibility that he will not get this tumor again?
Usually he may not get. I mean, 80 to 90% of the times he may not get.
Okay, so this radiation treatment, will it have any kind of side effects? Or?
Usually it doesn't have. Major side effects are not there. There may be minor side effects.